is a capillary puncture? Let's take a look. A capillary puncture is a method of blood collection that involves making a small incision in the skin, usually on the fingertip or heel, to obtain a sample from the capillary beds. Capillaries are found between the arteries and the veins and is the site where oxygen and nutrients are being dropped off and waste products are being picked up. Capillary blood is a unique mix of arterial blood, venous blood, and interstitial fluid, giving it slightly different characteristics than venous samples. Capillary puncture is often used when only a small amount of blood is needed, such as for glucose testing, hematocrit levels, or point-of-care testing. It's especially useful in infants, young children, or patients with difficult veins, offering a less invasive and more convenient alternative to traditional venipuncture. One of the most frequent uses of a capillary puncture is for blood glucose testing, both in clinical settings and at home using fingerstick devices. It's also used to measure hematocrit and hemoglobin levels, which can help assess anemia or hydration status. In newborns, neonatal screening, which includes tests for phenylketonuria and bilirubin testing for jaundice disorders, use a capillary puncture and is typically done through a heel stick. Capillary blood is also ideal for preparing blood smears, which are essential for evaluating blood cell morphology or diagnosing conditions like malaria or anemia. Additionally, point-of-care INR testing can be performed using capillary samples to monitor patients on anticoagulants like warfarin. Other common uses include lid-level testing and rapid HIV or infectious disease screening, especially in low-resource or outreach settings. Capillary puncture is valued for being quick, minimally invasive, and effective for obtaining immediate results at the bedside or in outpatient care. The appropriate site for capillary puncture varies by age to ensure safety, accuracy, and patient comfort. For adults and older children, the most common site is the side or the lateral aspect of the fingertip. And as the index finger has the most nerve endings, the middle or ring finger of the non-dominant hand is usually the best choice. The fewer nerve endings, and is less likely to cause discomfort or complications. The pad or center of the finger and the thumb should be avoided due to higher nerve density and callous skin. See the diagram above for proper location. It should also be taken across the grain of the fingertips in the direction noted above, as it allows for a nice drop of blood to form and for the blood to not run down the hand. For infants over 6 months and young children, finger sticks may still be used, but care must be taken to ensure the finger is warm and the puncture is shallow to avoid injury. In some cases, the big toe may be used if fingers are not accessible. For newborns and infants under 6 months, the preferred site is the heel, specifically the medial or lateral plantar surface, the sides of the bottom of the heel. This avoids hitting the calcaneus or heel bone, which can cause serious injury if punctured. The puncture should never be made in the center or too deep. See the diagram above for the preferred locations for a heel stick on an infant. The supplies needed for a capillary puncture include gloves and alcohol prep pad, a single-use sterile lancet, gauze, a bandage, a sharps container, and any collection devices you may need, such as a capillary tube, micro-collection containers, or cartridges that will be used in various machines. You may use optional warming devices on the body part you will be performing the capillary puncture to. Warming up the site helps to increase the blood flow to that area. Before performing the capillary puncture, warm the site if it is cold to the touch. This helps to increase blood flow and may help you get a larger sample for your tests. The warm compress should be used for 3 to 5 minutes. Next, explain the procedure to the patient. You might say something like, "Before we begin, I just want to let you know that we're going to do a quick finger stick or heel stick for infants to collect a small amount of blood. This test is usually fast and only causes a brief pinch or sting. I'll be using a small sterile lancet to make a tiny puncture on the side of your fingertip. Then, I'll gently squeeze your finger to collect a few drops of blood. We'll make sure your hand is warm and relaxed to help the blood flow easily. Once we have the sample, I'll apply gentle pressure and place a small bandage over the site. If at any point you feel faint, uncomfortable, or have questions, just let me know and we'll pause right away." What other ways can you describe the procedure to the patient? For capillary puncture, patient positioning depends on the site being used. If the finger is used, the patient should be seated comfortably with their hands supported, palm up, and fingers relaxed and warm. The arm should be at or below heart level to encourage blood flow. For heel sticks in infants, the baby should be lying on their back with the leg gently held and the foot stabilized. The baby can be swaddled with just the leg out and the parent or another healthcare provider assisting. A warm pack may be used beforehand to increase circulation. Proper support and stability help ensure a smooth procedure and reduce the risk of injury. Now that we have indicated the site and let the patient know what we are going to do, let's wash our hands or use hand sanitizer that is 60% alcohol or higher. Next, clean the site with the alcohol in a back and forth motion across the site. Using a sterile lancet with safety features, place the finger in the location and direction that we talked about, making sure that you are perpendicular to the fingerprints. Press the lancet down. Most will make a sound to indicate that the needle inside has deployed. Make sure that you dispose of the lancet immediately into the sharps container that is within arm's reach, and never set the lancet down for later disposal. Using a piece of gauze, wipe away the first drop of blood, as it will contain a higher level of tissue fluid and make the test inaccurate. While you may gently squeeze the finger to get the drop of blood necessary to complete the test needed, you should not squeeze hard or milk the finger excessively. This is going to cause tissue damage and bruising for the patient and cause hemolysis or damage to the blood cells that you are trying to measure. If there is not an adequate drop of blood, try another location, making sure that the location is warm enough, that the patient is adequately hydrated, and that your procedure is in the correct location. Capillary puncture procedures can be done directly into collection cartridges or have micro-collection containers for later testing. If collecting in collection tubes, there is an order of draw similar to the venipuncture procedure. The first tube collected is a blood gas, followed by an EDTA tube or lavender-colored tube. Next up is any other colored tube and then serum tubes. You can use the phrase, "baby elephants always sleep." After you have collected the sample, apply pressure with some gauze over the site of the puncture. Most bleeding will stop quickly in 30 seconds to a minute, but some people may bleed longer for up to 5 minutes. Make sure the bleeding has stopped before you place a bandage over the site of the puncture. Next, make sure that you label any samples that you have collected immediately while you are still next to the patient. Then document the procedure and any issues that arise from the issue and any waived test values you have run in the patient's chart.